Infectious disease experts are sounding the alarm. They warn us that another pandemic is not a matter of if, but when. The world witnessed the devastating effects of COVID-19. However, we are still woefully unprepared for a future pandemic, potentially even more deadly. We must heed these warnings and take immediate action. The consequences of inaction are too dire to ignore. The threat of a novel, highly transmissible, and deadly pathogen emerging is very real. The world is increasingly interconnected. This interconnectedness makes the rapid spread of disease easier than ever before. Despite the clear and present danger, global pandemic preparedness remains inadequate. This lack of preparedness leaves us highly vulnerable to future outbreaks. We must acknowledge the gravity of this threat. We need to prioritize and invest in pandemic preparedness. Our collective survival depends on it. We must learn from the lessons of COVID-19. We must strengthen our defenses and build a more resilient global health infrastructure. The world is ill-prepared for another pandemic. Funding for pandemic preparedness remains shockingly low. This lack of investment is a dangerous gamble with human lives. We are failing to learn the hard lessons from the recent COVID-19 pandemic. Governments worldwide must prioritize pandemic preparedness. This means allocating significantly more funding. These funds should be directed towards disease surveillance, research and development of new vaccines and therapeutics, and strengthening public health infrastructure. The current level of investment is nowhere near sufficient. We need a global, coordinated effort to strengthen our defenses against future outbreaks. The cost of inaction far outweighs the investment needed for preparedness. It's alarming to compare global military spending to investments in pandemic preparedness. The disparity is staggering and reflects a dangerous misallocation of resources. We pour trillions into military defense while neglecting the very systems that protect us from invisible enemies, deadly pathogens. Imagine if even a fraction of military budgets were redirected towards pandemic preparedness. We could build a robust global health infrastructure. This infrastructure would include early warning systems, rapid response teams, and state-of-the-art research facilities. This reallocation of resources would not make us more vulnerable to conventional threats. Instead, it would create a safer world for everyone. It's time to rethink our priorities. Investing in global health security is not just a moral imperative, but a strategic one. The COVID-19 pandemic, as disruptive and tragic as it was, should serve as a stark wake-up call. It exposed the fragility of our global health systems. However, experts warn that future pandemics could be even more devastating. COVID-19 might be a taste of what's to come, not the worst-case scenario. Imagine a novel pathogen with the contagiousness of measles, the mortality rate of Ebola, and the ability to mutate rapidly. Such a scenario, while hypothetical, is not implausible. We need to prepare for the possibility of a disease X, a pathogen currently unknown but with the potential to cause widespread death and societal disruption. The COVID-19 pandemic should not be viewed in isolation. It is a stark reminder of the constant threat posed by emerging infectious diseases. We must prepare for the next pandemic with a sense of urgency. The time to act is now. Section 5. Echoes of the past. Pandemics throughout history. History is replete with examples of devastating pandemics. From the Black Death in the 14th century to the 1918 influenza pandemic, infectious diseases have shaped the course of human history. These events serve as chilling reminders of the immense power of pathogens. The Black Death, caused by the bubonic plague, wiped out a third of Europe's population. The 1918 influenza pandemic killed an estimated 50 to 100 million people worldwide. These pandemics, while separated by centuries, highlight a crucial point. Infectious diseases do not discriminate. They can strike anywhere, anytime. Despite the advancements in medicine and technology, we remain vulnerable. The threat of pandemics is constant. We must learn from the past and prepare for the future. Section 6. The power of public support. A vital weapon. Public support is paramount in combating pandemics. Individuals must be equipped with accurate information and trust in public health recommendations. Community engagement and cooperation are essential for the effective implementation of public health measures. Building public trust requires transparency from health officials and clear communication. It also necessitates addressing misinformation and combating the spread of conspiracy theories. Education plays a vital role. The public needs to understand the basics of infectious diseases, the importance of vaccination, and the collective responsibility in preventing disease outbreaks. When individuals are engaged and informed, they are more likely to comply with public health guidelines. This cooperation is critical in slowing the spread of disease and protecting vulnerable populations. Section 7. Triumph and Uncertainty. The Oxford Vaccine Group's Race Against Time. The rapid development of COVID-19 vaccines, particularly the work of the Oxford Vaccine Group, was a testament to scientific ingenuity. The collaborative effort and unprecedented speed at which these vaccines were developed offered a beacon of hope during a dark time. However, the success of COVID-19 vaccine development should not lead to complacency. The next pandemic might present unique challenges. The pathogen might be more complex, making vaccine development more difficult. We cannot rely on a rapid solution every time. The development of the COVID-19 vaccine was a remarkable achievement. However, it highlighted the need for sustained investment in research and development. We must be prepared for a future where vaccine development might be more challenging and time-consuming. Section 8. The Spread of Misinformation, a Dangerous Epidemic. The COVID-19 pandemic brought to light another insidious threat: misinformation. The rapid spread of false and misleading information online hampered public health efforts and eroded trust in scientific evidence. Social media platforms became breeding grounds for conspiracy theories and unsubstantiated claims about the virus and vaccines. Combating misinformation requires a multi-pronged approach. Social media companies must take responsibility for content shared on their platforms. Governments and health organizations need to counter misinformation with accurate and timely information. Additionally, media literacy must be prioritized. Individuals need to be equipped with the skills to critically evaluate information online and identify misinformation. The fight against misinformation is crucial. It's about protecting public health and preserving the integrity of scientific information. Section 9. Building Trust, the Key to Public Health. Trust is the cornerstone of effective public health interventions. Building and maintaining public trust in health institutions and experts is essential. This trust is earned through transparency, clear communication, and a genuine commitment to public well-being. Health officials must prioritize open and honest dialogue with the public. This includes acknowledging uncertainties, addressing concerns, and explaining the rationale behind public health recommendations. Building trust takes time and consistent effort. However, it is an investment that pays off during a crisis. When the public trusts health authorities, they are more likely to follow their guidance, leading to better health outcomes for all. Section 10. A Global Call to Action, Investing in Our Future. The world needs a coordinated global response to the threat of future pandemics. This requires a significant increase in funding for pandemic preparedness. This funding should be directed towards strengthening health systems globally, particularly in low-income countries. Investing in pandemic preparedness is not charity. It is a global security imperative. A disease outbreak anywhere can quickly become a threat everywhere. We must move from a reactive approach to a proactive one. We need to anticipate threats and build resilience. This includes investing in early warning systems, research and development, and training healthcare workers. Section 11. The time to act is now, preventing the next pandemic. The COVID-19 pandemic served as a stark reminder of our vulnerability to infectious diseases. We cannot afford to be caught off guard again. The time to act is now. We must prioritize pandemic preparedness and invest in a healthier and safer future. Delaying action will only increase the cost of the next pandemic, both in terms of human life and economic disruption. We have the knowledge and the tools to prevent future pandemics. What we need now is the political will and global cooperation to make it a reality. The world is watching. Our response to this threat will define the future of global health security. Let us rise to the challenge.